In this video, I will be talking about Stye's, Hordeolum Internum and Chalazion. So if you want to know more about them, keep watching. I am Dr. Poonam Sharma. I am a qualified ophthalmologist with a postgraduate master's degree in the subject. In this channel, I talk all about eye problems, their solutions, and a whole lot more. So do subscribe and click on the bell icon. Stye is also known as Hordeolum Externum. Hordeolum means barley in Latin, and because this swelling resembles a grain of barley, and it presents or points on the skin outside, it is known as Hordeolum Internum. It is an acute infection of the hair follicle of the lid, along with its associated gland of Zeiss, which is the sebaceous gland or the gland that secretes oil or sebum, and the associated gland of Moll, which is a sweat gland associated with the hair follicle. Now, this is a staphylococcal infection, so it is most commonly associated with patients who have staphylococcal blepharitis. So here there is a tender inflamed swelling at the lid margin, somewhere near the lash follicle. It is red and it is painful, but there is no ocular pain and there is no diminution of vision. And usually it resolves on its own. Sometimes there may be involvement of more than one lash follicle, so multiple styes can also happen, and usually resolves on its own. But if it doesn't, then you apply a warm compress, that is, take a flannel cloth, soak it in hot water for about a few minutes, and then when it is tolerably hot, then apply it on the area involved for about 10 to 15 minutes. Repeat this application 3 or 4 times, and in a day or two, the sebum will melt and the pus will start pointing, and you gently squeeze it and remove the pus. You should also apply an eye ointment to prevent infection of the other hair follicles. Hordeolum Internum. This is an infection caused by staphylococcal bacteria, and it is an infection of the meibomian glands, which are present a little posteriorly within the tarsal plate, behind the gray line at the mucocutaneous junction. Now, these swellings are not seen anteriorly, so you have to invert the lid and then you can see the swelling. It is quite painful, and it presents as a swelling inside. So when you invert the conjunctiva, you can see it like this, or sometimes you have to invert it and see it inside. Now, this can get enlarged and then discharge either posteriorly through the conjunctiva or anteriorly through the skin. Normally it resolves on its own, but sometimes surgical intervention may be necessary. Chalazion or meibomian cyst. The obstruction of the duct of the meibomian gland causes retention of sebum or oil inside the gland, and once there is secondary infection, it results in a granulomatous inflammation. There is a planeless swelling in the tarsal plate, and the swelling is firm in consistency. The treatment is incision and curettage. You invert the lid and then you make a vertical incision and you curate out the contents. And so there is no scar visible on the outside and the swelling subsides. Sometimes you might have to give an intra-lesional steroid injection. That also helps dissolve it. So this was all about Stye, Hordeolum Internum and Chalazion. So if you have not yet subscribed to my channel, please do so and do click on the bell icon. See you again in my next video.